Welcome to the DSO Hygienist Podcast. I'm your host, Christine Deal. With over 30 years of experience in dentistry, including roles as hygienist, instructor, and dental team transition specialist. Here we delve into everything related to dentistry and DSOs, from industry trends to leadership to team dynamics and the strategies that help dental professionals thrive in this unique environment. Whether you're a seasoned pro or just starting your journey, this podcast is your go-to resource for insights, inspiration, and real-world expertise. Let's get started. Kendra Flowers, RDH, MSDH, is a seasoned clinical leader with over 20 years of experience in dental patient care, education, and training, clinical operations, and compliance. She is currently the Director of Programs at Harmony Health Foundation. Most recently, she served as Vice President of Clinical Excellence at Smile America Partners, and prior to that was the Director of Clinical Compliance Operations at Walmart Health. Kendra earned her bachelor's degree in dental hygiene from Northern Arizona University and a master's of science in dental hygiene from the University of Minnesota. Her diverse career includes leadership roles at Heartland Dental, Elite Dental Partners, and Pacific Dental Services. She is deeply passionate about advancing innovative care delivery models that address disparities in healthcare, especially among the nation's most vulnerable populations. Kendra is actively engaged in the profession through organizations such as the American Dental Hygienists Association and Women in DSOs. She lives in the greater Atlanta area with her husband of 21 years and their 3-year-old son. Just bought a dental practice? The paperwork's done, but now the real work begins. The team you just inherited is unsure, morale is shaky, and change feels risky. Introducing the DSO Team Transition, the go-to solution for new dental practice owners and small DSOs who want to lead with confidence and retain their team from day one. We give you a 30-day action checklist, staff meeting scripts, and a step-by-step roadmap to stabilize your culture, earn trust, and keep things running smoothly, all without the burnout. Download your free 30-day checklist for new owners at dsoteamtransition.com and start your leadership journey with clarity and confidence. Because buying the practice is just the beginning. Welcome, Kendra, to the DSO Hygienist Podcast. So glad you're here.
Thank you. Thank you for having me. I'm excited.
I'm excited to hear all about what you're doing, how you got into this. So we're just going to get started with the questions. I know you started as a dental assistant. How has that foundation influenced your approach to hygiene and leadership in the DSO space?
Yeah, I think it really shaped how I view employees. So being and starting at the bottom of the totem pole, you really have done every job. I've done every job except for being a dentist and an office manager. But you are in the weeds, you're cleaning, you're scrubbing, you're assisting, you're helping. And as I've heard other business people say, you respect your janitor like you would your CEO. My dad actually was a janitor at our school, so I already had that appreciation. But then being a dental assistant is the same way. And so when I was a clinical hygienist, I brought treats for my assistants. They work very hard. You can't run a modern dental practice without a good assistant. And I think that that's really important to know. Everyone plays a crucial role. And you'll hear that from everybody, right? Like, you couldn't run this place without me. And it's true. We need everyone to run a team. And I would say from a leadership aspect, really going back to that janitor perspective, treat everyone with respect. That's what I do. I treat everyone respectfully, no matter what you do. You should provide them the same amount of training, support, and resources, everything you need to make them be better at their job. And I think the other piece too is, I've had things thrown at me as a hygienist or as an assistant, and I don't ever want anyone to feel that way around me at any of the places that I support or work at. And so I think it produces a much better environment when everyone feels respected and appreciated.
I agree. Do you mean that people literally threw things?
Yeah,
Jeez.
yeah. I've been around in dental about 24 years, I think, if I add it all together. And so it started off in the days of film. I used to call the dark room my place to cry. I'm not a crier, but if I cried, it happened in the dark room because you're in there for, especially with a piano, for those of you that remember, you're in there for at least 5 minutes. And so, I think you never want that environment. It bleeds over into your patients, into your everyday work. Luckily, I had the maturity and emotional intelligence to know that that was their problem, not my problem. I did my job well, and so I used to get up and say, "Well, now I got to go get another instrument, and it's going to take even longer."
Love that.
But yeah, yeah. So I've seen a lot of things.
Yeah, yeah. I think in dentistry, we've all seen things where like, ooh. Mm. So looking back, what were some of the early challenges or surprises that you faced when you joined a DSO, and how'd you overcome them?
Yeah, so I didn't join a DSO until I became a hygienist, and I graduated in 2010. The best year to graduate. There were literally no jobs. I was told in school, I was told when I worked in private practice that DSOs, or as then we called them corporate, were evil. You never want to work there. They do horrible work. They're, ruining dentistry as we know it. And I didn't have a choice. There were literally no jobs. I would show up and they would say, "Well, you were one of the first 100 that got in before the first hour applying. So you're going to get an interview." And so I did start, I would say, I didn't know really understand what corporate or DSO or support meant at all. So I didn't know that I should have done my research. So very few people know, and I won't name names, but I actually joined a DSO for about 6 weeks, and I was just excited to get a job. It did not end well, and then I went to another, which was a much different caliber. So I will say there are good and bad as of anything. Same thing with private practice, but really do your research. I also had a really hard time because us as clinicians aren't taught business. So when you're attending meetings or your morning huddles, especially as a new grad, and they're like, "Oh, well, you weren't profitable this day, or you have to do," you're like, "What are you? I thought I just showed up and cleaned teeth, right?" Or whatever we were. Why are you talking to me about all of this? And so I think that transition was definitely harder. I would say now, at least from what I'm seeing in the DSO space, there's a lot better things like mentors and better onboarding and training that helps with that transition. But especially when there's DSOs that aren't, a merger or acquisition model, and where they do have that integration team, you're just coming in maybe straight out of school into there. That is definitely difficult. I will give a shout out to my first hygiene coach and now mentor and friend, Valerie Dangler, and she came in and taught me to make the switch from looking at it from a business aspect to a clinical quality aspect. So saying, "Well, why don't you do fluoride, or why don't you do this? Didn't you recommend it at school?" Yeah.
Hmm.
And so then all of a sudden it just clicked in my mind. Oh, Kendra, why are you letting insurance dictate what you do? And so when I made that shift, I found myself much more successful. I hope that one day they'll have in their curriculum at the hygiene schools or any school that kind of business to clinical mindset. But I know they have a lot to pack into a very short amount of time.
Yeah, I really love that. I think you're right. I really think there needs to be more business discussion in hygiene school to prepare you for what's going to be out there. And I also agree that there are good DSOs and bad DSOs. And I know I've been fortunate to work for a good DSO, and it really makes a big difference in your perception of what it is. So what role should hygienists play in shaping clinical protocols in their practice?
Mm. So there are definitely different levels, right? So when I think of a private practice office to a large, one of the big threes DSOs. So, I believe that those bigger DSOs, they do have hygienists on their advisory boards and their clinical advisory committees, those types of things. But I would say maybe for our private practice, small groups, emerging groups, it's vital that they're included, and might be an unpopular opinion that your assistants are included, that your billing staff, that your office managers, everyone should be included when you're helping to shape clinical protocols. And when I say that, I don't mean dictating treatment or recommending certain clinical protocols, but even in the end stages, it's going to be important because everything that you do affects something. And I have learned the hard way, I will say that always. Anything I do now is because I did it wrong to begin with, or made a mistake, or whatever it was. So when you make a change from a clinical protocol, okay, but what's the downstream impact to billing? All of a sudden, are we seeing denials? Why are we seeing denials? Oh, we just changed something that clinically makes sense, right? And that's okay. Again, you don't let insurance dictate your treatment, but then you have to change your entire workflow. Okay, well, now that we're doing this clinical protocol, the patient has to know out of pocket XYZ, and then we move forward with recommended treatment. And so that's why I'm a big believer in that. Or you make a change to the way your clinical protocols are, and now your whole scheduling changes. Or your assistant says, hey, that's not going to work because Dr. So and so won't get up during this treatment. But I think the person that's giving the service, that has some of the oversight, or you know more objective view, is always important. I believe in a team approach.
I love that. I do too. I think teams are so important and everybody has something to contribute, really. So you've worked in compliance, operations, and patient safety. How can hygienists contribute to reducing the clinical risk and improving care quality?
So this is a big one. I think hygienists honestly do this just by nature. I think it's our personalities. Most of us are type A. Some dentists are, too, but I think we really like protocol. As you probably have seen in your career, most of the OSHA or infection control people tend to be the hygienists. One, you have the scientific training, and then again, usually the personality that aligns with that. But my biggest thing, if you see something, say something. It's so cliche, but it's true. I have been with my husband for 26 years, and I know this, we just went way off track. But what I will say is, the reason people ask me how we've been so successful, I met him when I was 14, because we have conversations. Nothing gets solved if you ignore it, if you sweep it under the rug. What I will say is, if you do bring it up and it's either not addressed, or it's ignored, or not taken seriously, that's when you might want to evaluate your situation, right? So if you have a valid concern and you bring it up and it's not addressed, yeah, there's something else going on. Also, I'm a big believer, you never bring up a problem without a solution, even if it's not the final solution. And so I think you could say, hey, I'm noticing, you know, I don't know, the schedule, for our perio maintenance or something, that our patients can't get in for a year. This is kind of a clinical risk, right? We want them to come in every 3 to 4 months, whatever that looks like. So now we're potentially causing harm to our patients, and not intentionally, but it could be an issue. And so, saying, hey, maybe we need to hire another hygienist. Maybe someone could come help us out. And again, might not be the end solution, but especially in private practice, or even with office managers, dentists, right? They tend to lead. They are getting told 10,000 things all at once. They also did not receive training necessarily on how to operate an office. And so they don't always have all those solutions. And I think that's something that I viewed as an assistant, as a hygienist, and it's very much just the hierarchy of our system, is that dentists are at the top and they're end all be all, know everything, and we know that that's not true, but they need help too. So you want to make sure that you're playing your part and not just saying, okay, well, the dentist will find that. Oh, the dentist will do this. Oh, they'll fix everything. You're also licensed. You need to make sure that you're putting your patients and your safety or whatever it is first as well.
Yeah, see something, say something. I love that because so many times I think protocols have been in place just because it's been years and years and years and they need to be updated. Like that we're just doing the
Oh
same
my
thing we did in,
Yeah, it's
1986.
the way we've always done it.
Mm-hmm.
Oh my
Yeah,
goodness, that is the death of a practice
right.
in every aspect. The death of a business, actually. Forget a practice. If you do something the way you've always done it and the world is moving lightning speed, you'll never survive. Never.
Yeah, there's only one constant, and that's change. So, how has your view of quality care evolved since you've worked across many states and diverse patient populations? So, what does quality care look like in those different situations?
Yeah, this is a good one. Many people coming in may not have ever worked or had any experience outside of private practice. In my previous roles, I'll say, they're more non-traditional clinical models or delivery settings. And so the best way to think about this is sometimes with your patient population, you're meeting them where they are. So if you think about the special needs population, the aging population, you might not be able to remove everything. You might not be able to take x-rays. You might not be able to do a lot of things, but you do what you can. And for them, this is individualized care. For them, that's the best you could do and that they could do. And that is quality for them, right? Again, the compliance piece, as long as you document everything, you're not going to get yourself in trouble. Non-documentation is what gets you in trouble. And then the other piece is setting. So public or private practice setting versus a public health setting is a much different mindset. And so when you think about a private practice, right, you have essentially, not really, but essentially unlimited time with your patient, right? You have a lot more time, individualized care. The patient can or afford or have the option to, do additional things. So this is private practice is what I consider, the pinnacle of quality care. There usually is no reason to why whatever best practices, whatever is on the forefront of emerging technologies can't really be used. You get into public health, and that's again where you're in these non traditional settings or you have limited funding, limited resources. And really, the thought process is doing good for the broader community, and you do with what you can. And a lot of times, it's looking at best practices that are good in outcomes, but also financially efficient, especially if it's nonprofit, donation, government funded, or just free care. Any of you that have ever done like a Mission of Mercy or a RAM clinic, especially as a hygienist, they tell you just clean as much as you can off in 45 minutes and turn them over. You're doing the best for with what you have. And I think that's always what you look at no matter what situation you're in.
Yeah. Yeah, it can be very difficult in certain situations when you have a time constraint, especially. So, for leadership lessons, you have gone from being clinical to an executive. Can you tell us a little bit about that journey?
Oh, it's been a long journey. It's been a zigzag, no straight way. If anyone ever wants to reach out, I'll explain to you how I got to where I am. This is always the path that I wanted to get to eventually once I became a hygienist. It's not where I thought I'd be. But what I would say is for any of you that are looking to make that pivot from clinical care, I mean, to get into the role that I'm at, it's been, a 10, 15-year journey. I'm not a patient person. For those that really know me, I appear patient and calm. I am not. I sound very calm. I am not. And so it was very difficult. And it's, it's also not being afraid of change, but doing it anyways. And so if you look at where I've been, I've switched jobs frequently, and my husband again has the opposite. He's been at the same job for 20 years. And I can't comprehend that either. But I think that, you're going to have to put yourself in uncomfortable situations, or scenarios for you, not fully knowing everything, or experiencing a new environment like this new role I'm in. It's in the nonprofit sector. I've never worked in the nonprofit sector before. I'm uncomfortable, but I'm also learning a lot of new things and trying to apply what I do know into this new role. What I would say though is that hold your hold yourself accountable, hold others around you accountable. Everyone knows that I'm pretty easy to work with, but I have a very high standard and I expect you to get it done. Same for me. I'm probably harder on myself than anyone else. And so I think that's helped me do that. I was just watching a video on social media and it was Barack Obama, and it said something like, if you want to succeed, get stuff done. Just get the stuff done, and then people will see you as who you are, and then that's how you get promoted in. And even where I started, being really recognized, it wasn't in the clinical practice. Now my doctor was nice and he loved me, and I wasn't concerned about that. But where I was really getting seen was when I was volunteering at my old state dental hygiene association. I think I won volunteer of the year because I was at every single event they had. I was pitching in, doing all of these things, and yes, for free. But guess who was at those meetings? DSO, people, recruiters, vendors, and then again, you move forward to national conferences, and the same, at higher levels are there. And so, I really think that that's important too. To I always say your actions define you. So everyone's watching. Everybody is watching. They're watching with what you do, they're watching how you respond to certain things. What you don't do sometimes is the loudest. And so you will see, and no, I respond to every email, text, I try to the best I can. Sometimes I lose them. Every phone call, I follow up wherever I can. It doesn't mean that it's going to lead to something or to anything, but I want people to know that I'm paying attention, that I'm accountable. I'm going to do what I say. If I say I'm going to follow up, I'm going to follow up.
Yeah, I love it's growth begins outside your comfort zone, and I'm full heart believe in that. So, what's your take on the AI? AI, and that's just all the buzzword now. Everybody's AI dental, this AI, this
Yeah.
AI. So, what do you think about that? And like, how would you do that? Integrate it. I know we're getting fabulous AI and DSOs, but what do you think about
Mhm.
that for hygienists?
Oh, take advantage of it. So I remember when I first got out of hygiene school, I was thinking, man, this is like when you were like, I should have bought Apple when it first came out. So I used to think, I wish there was a computer program that would like measure bone. Well, I was thinking probing. Oh, they're there. I'm sure they're pretty close. But being able to measure bone levels and do all this, I don't have to do it. So the patient's not complaining and blah blah blah. Oh, they're close. And what I will also say is I pride myself on being the laziest employee that you have because I want to get it done quickly and efficiently. I don't want to have to do it over. I do a good job the first time, at least I try to, because I don't want to do it again. Have things work for you. That's probably actually the biggest life lesson I've learned as becoming a mom. I'm a newer mom, newish mom is, pay the $5 extra and have your groceries delivered for you if it just makes your life 10,000 times easier, especially when it, for the most part, works. We're not perfect. Is AI perfect? Absolutely not. Are you going to review it? Yes, you are. I actually just had my cleaning and exam done yesterday, and it's a local private practice. My old DSO doc retired. Well, he left the state, so I had to find a new one, and they used an AI program, and I thought it was amazing. All I remember is having to preheat the patient for my doctor. Sometimes it worked, sometimes they didn't believe me. She literally put it up on the screen and said, 1 minute oversight. This is what they're seeing. We'll have doctor come in and verify. It was so easy to see. Even as a hygienist, I was just so impressed. And so, it's nice to have additional backup outside of a doctor, right? Just saying that we're right, because normally we are. And even, now you have maybe 3, 4 points of contact, right? You might have an assistant that's taking your x-rays that does the same thing, and then you come in and do it, and the doctor comes in, and then the coordinator comes in, the treatment coordinator, and says the same thing. So you just have more and more exposure for that. But then I would say chart reviews, me being the person on the back end that's had to manually review charts for a very large DSO, it makes it more consistent, one, and definitely more objective, less subjective. So it's not just, well, this is what Kendra prefers. It's like, no, well, no, this is based on care standards from ADA or AHA. It will level you up as a hygienist, right? If you are able to maybe have one that generates your notes for you, or is listening in. Now they have these things that listen to your conversations and put it in. And that was my thing. I'm a big documentation person. So the fact that I didn't have to take a little note of what our conversation was, so I could go back at the end of the day and that it's just summarized there, is game changing. And I think we're asked to do more and more and more and more with less time and sometimes less resources. So if you can use this to be more efficient and to get more for your patient, just do it. Do it. Don't be scared. Be uncomfortable, a little uncomfortable.
That's right.
It's the same thing when we went from film to digital.
Mhm.
Oh my God, you would have thought the world was ending. And now everyone's like, oh, you don't have to clean that thing. And they come out, they don't get lost, and you don't have to fax or someone faxes. I'm like, it's coming. Just join in. Just join in.
Yeah, I had to clean the X-ray processor, so I'm so glad that thing is gone.
Me too. Or digging out x-rays that were lost.
Right.
Oh God, I forgot all about it.
Right?
Yes.
So, how can hygienists advocate for themselves if they want to grow into a leadership role within a DSO?
Yeah. One thing I've found is sometimes leadership tends to look, especially on the business side, not always on the clinical side, they look at the top producer or the most, effective clinician as that they are the ones that should be a leader. I do not think that's true. Sometimes you're just a really good producer, and that's okay. That doesn't mean you have the ability to do what you do and teach others, or you don't have the ability to coach others. And those are very different skills. I was not a top producer in any of my DSOs. And I mean, of course we're all competitive. I struggled with that a little, but I knew I was doing really good care, providing that. But I was the one that was like, so why are we doing this? Here, I have a solution. Here's this program. I wasn't always heard or maybe taken seriously. And that's where I say, maybe it's not the right place. And that's what I found is moving from organization to organization and getting the opportunities elsewhere. That's hard for people too, but sometimes that's what you have to do because people see you only as a clinical hygienist or only as a certain thing. And no matter what you do, I've also seen where they don't want to move the top producer out because they want their revenue. And that I don't think is fair to the person, especially if they've expressed that they want to move on or forward. And so again, it just, you need to evaluate where your goals are and what's being done, right? If you're waiting 10 years for a promotion, especially nowadays with, I don't even know how many DSOs there are, thousands, and every day more are starting, there's plenty of opportunity out there. You have to find them, you have to get out there. One thing I will say as well is almost every job I've gotten out of clinical was not listed on a job site. You got to get out there. It's hard. I'm telling you, I invested and I'm not advocating for this, but I put plenty of conferences on a credit card and then did some side work to pay off things. I invested in myself. I still continue to invest in myself, whether it's through coaches or conferences or whatever that looks like, because I know that it pays. Now, not always right away, which is what we like, especially here in America, and I'm guilty of that. But it does pay, and I think I saw, and it was most evident. My most recent conference I went to is called DICOMA. It's a really big conference that DSOs attend. A lot of DSOs. I forgot how many people I knew. I forgot how many connections I made. And it was just so nice to see that all of that work over the last 15 years of my 20 years of my dental career paid off in all of those rooms or in the hallways when I'm getting hugs and pictures and all of those things. But that also know that if I need to leave or I want to grow, I have a network out there that can be my eyes and ears as well.
Yeah, networking is so important. And I think too, like you said, you have to feel valued. You know, if you're not being valued where you are and you want to move into a leadership position, then, like you said, maybe you need to change and go somewhere else. That's great advice. If you could give one piece of advice to a hygienist that's burned out in a clinical practice and curious about DSOs, what would it be?
I would say it depends on what you're looking at out of a DSO. So if you're looking at a clinical practice at a DSO, maybe transitioning from private practice or from DSO to DSO, on both scenarios I give you, do your research, read reviews, job boards, Glassdoor, I think they have where, they give feedback on company CEOs, everything. Do that for sure. Or if you have friends that work there or in the communities, Facebook's kind of gone away, but if you still belong, every once in a while you'll see something and like a dental community, local community, they'll talk about different DSOs. Hear them, as you know, they see the day to day. Sometimes it's a bad office. We know that, right? Out of a good DSO, but you'll see trends. So I would say that. And now because there's, staffing shortages or not, maybe that's debatable. You can also try to temp at some of those places just to get a feel for their systems and what it looks like. And then if you're trying to move out of clinical practice, really one thing I have found is, LinkedIn has been a really good place for me to follow journeys of others, follow the company, see how they're going and they're developing. But a lot of times you are able to see what was the progression of that person. Like maybe you want to go into compliance, or maybe you want to be an OSHA person, or maybe you want to do the integrations. Look at the people that have those roles that you want to be like and see where they started. I mean, I've seen some people in clinical roles, which is curious, and I need to reach out to them. But they were never clinical. Maybe they're really good operations leaders, and that's okay too. And then they leave all of the clinical judgment and decision making to the clinicians. But either way, do your research for where you want to go.
Great advice. I would like to thank Kendra for joining me today. Kendra, if listeners want to get a hold of you or have questions, is there a way they can get a hold of you?
Yeah, I would say follow my LinkedIn, and you can message me through LinkedIn. So it's just Kendra Flowers. That's the best way I keep track. Email can get overwhelming, but then you can also see my LinkedIn. Like I told you, if you're curious about mine, you can see kind of my career progression.
Well, thanks again for being on the DSO Hygienist today.
Thank you for having me. Have a good day.
Thank you for listening to the DSO Hygienist podcast. Please follow or subscribe to be alerted of new episodes.